There are approximately 2 million amputees living in the United States, and a full 500,000 experience debilitating phantom pain that's being caused by a neuroma. Question is, how do you know if your phantom pain is caused by a neuroma? Stick around for this 2-minute chat to find out. When a surgeon is performing an amputation, he or she will take the nerve, cut it, and then tuck it back into the soft tissues. Problem is, as the residual limb heals, the nerve will have a ball of scar tissue forming around it, and this is a neuroma. Some folks develop neuromas and never know about it. Other folks develop neuromas but are able to work around it with their socket fit and adjustments. But for others, the pain being caused by a neuroma can be debilitating. And according to Dr. Gregory Dumanian, sometimes there's just no rhyme or reason as to who will be affected more severely by their neuroma. When I have a patient who presents with phantom pain or residual limb pain, I always like to ask, where, what, how? Where do you feel the pain coming from, and can you point to it with your finger? What triggers your pain? How do you relieve the pain if you are able to at all? The answers my patients provide can help me differentiate between pain that's being caused by a bone spur, a pesky neuroma, or some other cause. If you check out this video below, it explains some of the other things that can cause pain in your limb. Now, if I think my patient might have a neuroma, I'll put pressure on the area where they have the pain and push in with my thumbs. If I can replicate the pain, then I know I'm on the right track. Now, it doesn't mean I'm 100% sure there's a neuroma. Remember, I don't have X-ray vision. But it lets me know that there's a physical structure inside causing the pain. And at that point, I refer them to a skilled surgeon such as Dr. Gregory Dumanian to continue the diagnosis. Now, you may recognize Dr. Dumanian's name because of his frequent appearances on the Cosi talk show. He and Dr. Kaiken were the creators of targeted muscle reinnervation, a procedure that's used to get rid of these troublesome neuromas. So when I spoke with Dr. Dumanian about his approach to diagnosing these neuromas, he echoed many of my own strategies. He also does careful interviews with his patients to determine if their symptoms point to a neuroma. He says that depending on what he hears from his patients, he may order an ultrasound to confirm the diagnosis. And if he feels the patient is a good candidate for TMR, he will administer an injection to the suspected neuroma to see if the patient feels relief. If it works, next step is the TMR procedure. And you can find out more about that in the links below. Now, if you suspect that you have a neuroma that's causing you pain, communication with your physical therapist, prosthetist, and surgeon is key. Get the right diagnosis, get the right treatment. Now, if you like what you heard, hit subscribe and give me a thumbs up, and feel free to leave your questions in the comment section.